Hey, this is John Hansbrough. So today I want to talk a little bit about a really interesting partnership that just came into the market for health insurance in California and a few other select markets. And that's between Cigna and Oscar. So Cigna is one of the 800-pound gorillas in the health insurance market. Depending on how you measure it, they might be one of the top 5 or 10 largest carriers in the market. Oscar is a relative newcomer to the health insurance game. They just recently IPO'd. They were founded earlier in the 2010s. They sold their first health insurance plan in 2014, so it's a pretty rapid rise for them. So this video is going to dive into that partnership, what it means for employer groups, and what you should know in case you want to look at these benefit plans for you and your team. Let's go. The main thing about this is that it's selling Oscar. Oscar is a really popular health insurance carrier, specifically with younger generations, but even across the board. And we're seeing that now with Oscar starting to look at getting into the Medicare Advantage market, which kind of by definition is people over the age of 65, unless you're, chronic kidney disease or some other conditions like that. That means you don't need to be 65 to get them. So again, long story short, Oscar is really popular with relatively younger people. Most people don't usually like their health insurance carrier. It kind of is just what they need to have in order to get access to doctors and medical care and whatnot and get those things paid for. So the fact that Oscar boasts really high net promoter scores is a big deal. We don't usually see high net promoter scores with health insurance carriers. They're typically along the lines of cable companies like Cox or Spectrum. And so you don't usually hear people saying anything about the other carriers in the market. So Oscar's really popular. We like that about them. Why is it popular, though, with young people? Why do people actually care about this health insurance carrier? They do a lot of cool things like offering a nice mobile app, a dedicated care team, some care navigation tools, and just a general good platform and user experience for people accessing these benefits. Within their mobile app, you can get access to your care team, and that's going to include both a nurse, a couple different care guides, as well as your doctor. So this isn't just some siloed physician who's answering some messages from you, but it includes a number of people who can make sure that the care you're getting is going to answer the questions that you have and that it's affordable and it's just appropriate for what you need. One of the main pushes that we're going to start to see in healthcare is this increasing use of pharmacists, nurses, nurse practitioners, physical therapists, behavioral therapists, nutritionists, any other people in healthcare besides doctors. They're all going to start playing a bigger role in care delivery for people as we shift from a sick care system where we're treating people once they get sick to a healthy body, healthy mind, healthy person concept where we're treating people ahead of time. We're helping them live healthy, happy lives so that we're getting upstream of issues before they create more significant and more costly conditions, joint replacements, all these kinds of issues, diabetes, depression, all these issues that can lead to less than ideal outcomes for people can be addressed upfront, affordably, and really effectively through the use of coordinated care teams. Not only that, but your doctor can see your online medical record through the app so they are aware of things that are going on for you. They're aware of your medical history and they can take that into account. So you can start virtual visits for $0. They have a $0 24/7 telemedicine service. And this is a really big push for them. They're trying to triage care for you. They're trying to create a digital front door to healthcare through their mobile app. The idea there being that they can reduce costs through unnecessary doctor visits, as well as triaging care so that people are going to the right place for the right care. We always hear stories in healthcare about overutilization of emergency room departments because people just think that's where I'm going to get care and that's the best place to get care. In reality, a lot of emergency room care can be transitioned to either urgent care or completely non-urgent care whatsoever and just through doctor's visits. That's something that a lot of people don't realize, and it drives a lot of the costs because ER visits, as we know, are very expensive. So creating a digital front door is a very big deal for navigating the healthcare system, and this is one of the areas that Oscar believes it's going to create a lot of value for people, and people have been reciprocating with because we hear from employees they have to have Oscar. We don't usually hear that about some of the other large health insurance carriers. So that's definitely a big thing that stands out when it comes to Oscar. Oscar offers other programs, and in particular in conjunction with their partnership with Cigna, they have a mental and behavioral health platform they can go through. And with Cigna, they have these large national networks that Oscar kind of struggled with early on. That was the main gripe we had as benefits brokers, trying to push Oscar into groups of saying, they don't always have all of the providers that you may want, But with Cigna, they're getting access to Cigna's Open Access Plus and Local Plus networks, which means that in Northern California, they get access to Sutter, UCSF, Stanford, John Muir, HSA, and others. And in Southern California, they're getting access to some local providers like Scripps that are going to be really great for people in certain markets. Of course, like anything, whenever we're looking at a new health insurance carrier for a group, we have to take into account where the employees are located, where the company is located, and where they're going to access their care. That being said, this Oscar Cigna plan seems like a really good value proposition for certain employer groups. If you have employer groups that are relatively young, maybe if your team is pretty digital savvy, Oscar Cigna might be a good move for you. Their plans are pretty competitively priced to most PPO plans out there, so they might bear a good look from you at renewal time. So if you have questions about that, or if you want to know more about Oscar and Cigna, please let us know. We're happy to help. Thanks and have a great day.